Dr. Davin Lim, board-certified laser dermatologist. Today we'll be talking about birthmarks. Look, there are many different types of birthmarks, but we'll be concentrating on brown birthmarks and the option, once again, it's the option to have them removed, because some patients actually embrace their birthmarks and don't want to have them removed, while other patients request birthmark removal. So you can see with this video, I'll go through how to remove two types of birthmarks, and these are brown birthmarks. One's called a café or lait macule, and the other's called a congenital melanocytic nevus. Now, it's very important you get the diagnosis right, because some birthmarks, such as CALMs or café or lait macules, can easily be removed with a laser, whilst other birthmarks, such as congenital nevi, are resistant to laser. So you'll see in this video how this one patient goes through this journey, which takes him an entire year. Everything from surgical through to vascular and CO2 lasers to get to the very end. Well-motivated patient who wants his birthmark out, and he gets a very good result. So thanks for watching this video, and yeah, I hope you learned something. Two most common brown birthmarks are congenital melanocytic nevus, the one on the left, which occur in 1 in 100 births, compared to the café or lait macule, which occur in 20% of patients. This is a congenital melanocytic nevus, and so is this, and so is this. So these are all congenital melanocytic nevi. They can occur as medium-sized lesions or extensively as large lesions. So the story begins with Mr. S, who saw me approximately a year ago. He had a medium-sized congenital melanocytic nevus. Now the treatment of choice, yes, this is graphic, is excision. Lasers certainly can help, but they really frequently occur with laser therapy. So the treatment of choice is actually serial excision. So you can see me excising this lesion, closing it up, and the whole idea is to actually treat this birthmark whilst giving him the least amount of scarring. So instead of doing it all in one procedure, you can see I'm actually removing the birthmark within the birthmark to give him the smallest possible scar. So he comes in for a second procedure about 2 to 3 months later, and I remove more of the birthmark. Once again, I'm cutting out the scar, but a tiny bit more birthmark. So you can see right at the end, he's got this star-shaped flap, which I'm just about to do, and a little dog ear. And then after that, what I do is I laser the area. So I laser the residual bits with a carbon dioxide laser, and also the dog ears. In other words, the raised areas of the scar. Then I flip over to what's known as a fractional laser. So a fractional laser can help with the overall scar, making it softer, but as with all scars, they evolve over time. So over the next 6 months, his scar becomes red. So what do I do then? I then use a vascular laser. So you can see it's almost gone. We're using a vascular laser, and the vascular laser, as the name suggests, targets the blood vessels. So let's have a look 12 months later from beginning to end. This is what the end result is. Minimal scarring. Sure, if you would like a beard in that area, we can actually do a follicular unit hair transplantation. So at the end of the day, it can almost be a scarless procedure because the beard can hide the residual scarring. So beginning to end, that is 1 year, my friends. It's not an easy process, but if you're motivated, certainly seeing a good plastic or dermatological surgeon can help. Now, the second lesion we're talking about is the café or lait macule, which is much more common, occurring in about 10% of patients. Ordinarily, I would use the Pico laser. However, this laser, even though it's an excellent laser, has not got the energy level at the wavelength I want at 532. So I swapped back to my old laser, which is the Revlite. This uses nanosecond technology, but it works. So let's have a look at the before. So this is what I'm treating, a café or lait macule. So café or lait macules are very common, but when they occur in certain areas like the face, certainly that can be a concern. So here I am treating this lesion with the 532 laser. You can see I've put internal eye shields to protect the eyes. And I'm lasering around there. This is her third treatment, so you can see a marked improvement, and the end point which I want is just a little bit of frosting in that area, and that's perfect. The skin, let's have a look at the before. And let's have a look at how she heals up. This is what she heals like at day 6. So it takes about 7 or 8 days before the scabs go. This is what she looks like after the second treatment. You can still see some residual areas of brownness. And then what she looks like after the third treatment. So she had a 4th treatment just to clean up the areas. And at the end of the day, she's extremely happy because the birthmark she's had for 26 years is now gone. Okay guys, so you can see from that video, it can take anywhere up to a year to remove a birthmark, especially with surgical methods, but certainly with laser, it's a lot quicker, a lot easier. But you've got to actually identify the type of birthmark before you remove it. And remember, not all people want birthmarks removed because that's part of them. They've grown up and it's just part of them. So always respect their wishes, okay? Guys, thanks very much for watching this video. One new video every Saturday morning, Brisbane time. Please subscribe. It's very close to 100,000 and I just can't believe how much this channel's grown. So look guys, much appreciated. I'll see you next week. Bye.